Good morning. I think yesterday one parent called from Aba. That should be I don't know, but from Aba, from one of the eastern states. The mother called and that should be past 3 at night. I picked the call, I answered, and I gave her non-medical, like non-pharmacological methods to attend to the baby as at that night because I could hear the baby crying due to the pain. The baby was having crisis, 5 years old. So she did, and the the approach kept like they could manage the baby till morning. So I was waiting to hear from them, and I think past 9, the lady called again and was like, okay, that she's still feeling the pain. I was like, okay, take the baby to a nearby pharmacy. You get so getting there. I don't know. She was expecting me to prescribe a strong, a strong painkiller for a 5 years old, probably pentazocine. So when she called, then I told her to give ibuprofen with the one with paracetamol. So she was not comfortable with my prescription. Then she got to the pharmacy, and the pharmacist prescribed same thing, like ibuprofen with paracetamol. So the lady came to the national platform and was like, and make her not fear. And she they called me just now. Now she called, say she was thinking probably I was scared that it's a setup for me to prescribe a painkiller for the baby. That's why I was scared to probably prescribe pentazocine or diclofenac or tramadol. I tried to make her understand that the first approach to crisis, uh, it's not it's not pentazocine, it's not diclofenac, it's not those opioid analgesics. You get the first approach is the non-pharmacological method because as soon as your system gets used to those drugs, the pentazocine, the tramadol, at some point you'll be addicted to it, forgetting the side effects first. You'll be addicted to it, and when you now have serious pain, like serious crisis, and you call for those drugs, they won't be effective because your system they've all been used to it, like your system has been used to it. So that's why we normally advise you go for the non-pharmacological approach first. You get, and this non-pharmacological approach, I think we've talked about this before now, whereby you have the hot water massage, you have the sometimes whatsoever the patient does best or what the patient likes is also a therapy to pain for that particular person. So I advise people, don't go for, once you have pain, don't go for pentazocine as in, don't go for pentazocine, don't go for tramadol as your first approach. Use the non-pharmacological method, and if that is not working, then you use mild analgesic like diclofenac, not the injection. Diclofenac um, tablets. You get, that's it. So the basics of this series now is that your first approach to pain, your first approach to crisis should not be strong opioid analgesics like pentazocine, tramadol, and the likes of it, or ketamine and all. You get, so what you do, your first approach should be the non-pharmacological method, which keeps you safe first, and secondly, it keeps your body on, like it keeps your body like when you are in serious pain, then um those strong analgesics can come in and they will help out. But once you've started taking it as your first approach, I bet you'll be addicted first of all, and secondly, you'll be your system will not be effective with the drug. Thank you.